Hello. This is Dr. Badman's avatar, and I am here to check on how you are doing since surgery. Today is postoperative day 2. I would like to review your dressing care and how to properly remove your surgical dressing and sling. At this point, it is still normal to have pain. Typically, day 2 after surgery is the worst, and your pain should continue to gradually improve from here. If you are able, try to begin weaning off of your narcotic pain medication and transitioning to over-the-counter medication. You should still be taking 1,000 milligrams of Tylenol every 8 hours or 3 times per day through postoperative day 5. You may also take ibuprofen up to 800 milligrams 4 times per day as long as you are allowed to take this medication. Stopping the narcotic pain medication can also help improve nausea or constipation, which are common side effects. The large outer dressing that is currently in place can now be carefully removed. As you remove this bulky dressing, you will see a white strip covering your incision. This is called a silk dressing. It is waterproof, and I want you to leave this strip in place. We will remove it at your first postoperative visit. If you had arthroscopic surgery, instead of a single large dressing, you will see several smaller incisions covered with steri-strips. Leave the steri-strips in place, but then cover the separate incisions with several large waterproof band-aids. I would recommend changing the band-aids every 3 to 4 days. Changing these more frequently can irritate your skin. Once the bulky dressing has been removed, you may shower. Do not scrub your incision, but it is okay to allow water to gently run over it. Do not submerge your incision in a bathtub, hot tub, or pool. You do not need to cover the incision with anything else. However, some patients prefer to protect the area with extra gauze and paper tape, which is okay. If you notice any increasing redness, drainage from the incision, or have any other concerns, please contact our office. Let's also discuss your shoulder immobilizer. You will obviously need to remove this to get into the shower. This sling is designed to not irritate your neck, and instead wraps around your other shoulder for support. As you can see, there are several straps in place. So follow these instructions to prevent creating a bird's nest when everything is all said and done. To remove the Ultra Sling Pro, first remove the forearm and thumb straps. Release the waist belt quick release buckle at the front of the cushion. Disengage the quick release buckles at the front of the arm sling. Slowly remove brace by lowering the pillow and sling below hip. To reapply, place the forearm in the arm sling first. Secure the forearm and thumb straps. Bring the waist belt around to the front of the cushion and secure the quick release buckle. Next, bring the shoulder ring around the back and slide healthy arm through the ring. Reattach the quick release buckles at front of arm sling. There is no magic angle for your elbow, but usually placing it around 90 degrees will feel the most comfortable. If by chance your sling is too long, you can simply unbuckle the connector, fold the sling inward as shown, and rebuckle the strap. Also, the straps at the upper area here are also adjustable and can be trimmed. Finally, this is how the piece should look around your opposite shoulder as a reference. The real Dr. Badman will plan to see you back at your first postoperative visit.